You're watching Crossroads on I24 News. I'm Michelle McCory.
And I'm David Schuster.
Senate Republicans have released a revised version of their health care bill. They're still struggling to repeal and replace former President Obama's Affordable Care Act, also known as Obamacare.
The legislation has already been met with some criticism and even flat-out opposition from Republicans that could torpedo their bill before it gets to the vote for a floor. Gets to the floor for a vote next week. Correspondent Aaron Katersky has the latest from Washington.
And thanks to Aaron Katersky for that report. For more analysis, we're joined here in studio by Dr. Dennis Deruelle. He's the Vice President and National Medical Director at BPCI Services at Team Health, which is an organization that works to improve medical services. What is your initial reaction to this?
Well, I think it's a much better bill, and I think it really addressed some of the key issues from my standpoint. We need some flexibility in these plans, and the Cruz Amendment does that. So now you have a plan that can cost less. We're bringing the price down, get more people on it, and yet those people, those insurance plans, have to put a plan in the regular exchange. Secondly, $45 billion for the opioid crisis. And finally, money for the states and insurance companies to stabilize these markets and give some help to that out-of-pocket spending that the Medicaid patients that move from Medicaid to private subsidized will need. So I like it. We're not completely there, but I like it.
And Rand Paul won't support this bill because he doesn't believe that insurance companies should be getting any government help.
That's exactly right. Well, he would like a pure free market, and in fact, I would too, but we can't all of a sudden have people on the cliff, insurance companies and patients, because they've been wrapped up in Obamacare, the way it's been arranged, and then all of a sudden do a private market like Rand Paul and flip the switch and not throw a line to those people. So I think this bill moves towards what Rand Paul wants, but we're going to have some money in the meantime to get there.
Well, Dennis, as a doctor, one of the big criticisms leveled against Obamacare was that it took away from the doctor-patient relationship, that it took away from the doctor's abilities to interact as they want with the patients and from the patients to choose the doctors that they wanted. Do you think that this bill addresses that?
Yeah, I really do, because I think that, first of all, if you got to look at Obamacare, it put 15 billion people on Medicaid instantly. Now, I think those patients are going to move to private insurance. In my opinion, they were churning from Medicaid when they made more money to private, back to Medicaid, and they were going from one plan to the other. If you move them to private insurance, they should get one doctor and keep that doctor. Secondly, I think having more flexible plans, if you have a catastrophic plan, that means that you can spend some of your HSA money, pick the doctor that you want, pay a private amount of money and a cash to that doctor, and be covered for out-of-pockets. So I think the flexibility is going to let people keep their doctor more than the Obamacare plans.